In this video, we're going to be going over the stages of labor, and we have three stages of labor. We have early and active, then we have birth, and then there is the birth of the placenta. So in this video, we're going to go over each one of those stages and learn a little bit more about what happens in the hospital and kind of what tests are being taken and done. So even before a pregnant woman gets to stage one, she may feel these practice contractions called Braxton Hicks. And so they may last, for several minutes to much longer than that. But your body is essentially getting ready to, shed that uterine lining while, the birth is being taken place. So our stage one is early labor. And the first stage of labor, you're going to feel these persistent contractions, and they're going to become stronger and more frequent over time. What is happening is it's causing the cervix to dilate or open and also soften and shorten because it is like kind of long. So it's kind of shortening that space. And then it is effacing or thinning out so that the baby can move through the birth canal. So this is the longest of all the three stages, and it is broken up into two different phases. We have early labor, which can happen or which can last 6 to 12 hours or sometimes even up to 30 hours. And then we have that active labor where the baby is actually, going through the birthing canal. So early labor is your cervix is dilating, effacing, and then you're feeling these irregular contractions happening. And so at this time, you do not need to go to, well, at this time, you just need to take note of how often things are going, how often the contractions are happening, how long they are, and talk to your doctor. This is where you're having that conversation with your doctor. Hey, I think that this is the time. So ways that you can promote comfort during this time is like going for a walk, taking a shower or bath, listening to relaxing music, anything that's going to help you self-regulate emotionally is going to help your body kind of relax physically as well. So you can try breathing or relaxation techniques, which are often taught in like the birthing childbirth classes. You can change positions. Sometimes that helps. And then your healthcare provider, your doctor will instruct, or your midwife will instruct you to when to leave for the hospital or even like the birthing center, or, when it's time to prepare the environment for like the water bath, if that's something that the woman is deciding to do. So active labor is when the cervix is dilated from 6 centimeters to 10 centimeters. So contractions are becoming even more stronger, more regular. You may feel your legs cramping. You may feel nauseated. And then you may even feel your water break if it hasn't already. So that's what's going to happen with that is there's going to be more pressure on your back. So again, if you're not haven't already headed to the hospital or have gotten, the water bath ready, now is the time. And then at this time, you can ask for pain medication or anesthesia if you want. Typically, labor lasts between 4 to 8 hours often. Typically, the cervix will dilate 1 centimeter every hour. And so there's like, there's 4 hours, right? And then it can take longer than that. So just kind of mentally prepare yourself for that. And so you can manage that by breathing, doing those relaxation techniques. So during active labor, so from 6 to 10 centimeters, the cervix is dilated. There is this transition phase, and it is the last part of active labor, and this can be incredibly intense and painful. Contractions will come closer together. You may even feel it like every minute. And the pressure that you're experiencing on your lower back as well as your rectum, you can absolutely feel that. So, you can tell your health provider if you feel the urge to push in order to, alleviate that pressure, that pain. So we got stage two, the birth of the baby. So it is time, and you'll deliver the baby during the second stage of labor. Typically, it lasts from a few minutes to even a few hours, and even more. And that all has to do with like how much your baby is able to be pushed through that birthing canal, and so it takes effort on the mother as well as the body itself. So it may take longer for women who are having a child for the first time, um, as well as women who've had an epidural. And I do want to just like make a note here. Let's go back, Abby, and include something about an epidural. And typically at this point, when you're like typically at this point with delivery, you can't ask for an epidural at this time. This happens like during early labor, maybe even active labor. But I do want to go back and like make sure I'm giving you the right information. So anyway, going back to delivery, what can you do during this time? If you are pregnant, having a delivery, you can push. This is the time to push, push, push. The healthcare provider will ask you to bear down during each contraction or tell you when to push. And it's just like that physical feeling. You may also be asked to push when you feel the urge to do so. So it kind of depends on that communication between you and your doctor at that time and what's best for you. After your baby's head is delivered, the rest of the baby's body will follow shortly. So, in the 10th month, the 9th, 10th month of pregnancy, the child is turning face down, so that their head can be delivered first. And so, if sometimes there may be a problem with that, um, the baby may get stuck within that birthing canal. And so, the doctor has these different techniques to make sure that that child is going to be okay. And it's really the amount of like swiftness that happens during that transition is like really crazy. So, very thankful for doctors. And that's also like part of the reason why some people choose to go to the hospital as opposed to having like a water birth or something at home, because you may not have that ability to do so, but your midwife should be knowledgeable enough to have that. And so that's absolutely a question you want to ask. Anyway, there's also other problems that may happen. And the body is a natural, or the birthing process is very natural, and it's happened for a very long time, and a very long time without the hospital. And so this is something that you personally need to talk to you with your partner, have that communication with your doctor so that you can make the best decision for you, because this is a really crazy, painful, amazing experience that, I don't know personally, but just the miracle of birth. So yeah, let's go back to delivery. After the baby's head is delivered, the rest of the baby's body will follow shortly. Um, the shoulders are like the hardest thing that kind of get past the birthing canal. And then also the head of the baby is very soft, and there are like bone plates that have overlaid on top of each other to make sure that the child can go through that birthing canal, or help them at least. So after the baby's body is delivered, the baby's airway is going to be cleared if necessary. So this all happens very quickly. Sometimes the delivery of the placenta, and then the things that are happening after birth kind of all happen together too. So, part of this process after the baby is out is clearing their airways with one of those little suction things. If the delivery is uncomplicated, the healthcare provider may wait a few seconds to minutes before they cut the umbilical cord, and that's just to help with the increase of nutrient-rich blood from the cord, the placenta that has been the life force for that child. It also increases the body's baby's iron stores and risks and reduces the risk of anemia and promoting, and of course, that approach. All right, we have stage 3, which is the delivery of the placenta. So your baby is born, the nurses have your child, they're doing tests, they're suctioning out, they're making sure baby is okay. So after your baby is born, you're going to feel a huge sense of relief, right? That makes sense. And you might hold the baby in your arms or in your abdomen, and this is called skin to skin. And this is like, that first time where you get to feel your baby on you. And so you really want to make sure that you are cherishing this moment. There's a lot of things that you have just gone through, but that relief that you feel is that relief, that light at the end of the tunnel. So enjoy it. And at the same time, there's a lot going on in that environment that you're in. So it is very hard to just tell you to enjoy it. But, you have the support of your family there. And, there is no perfect way to have a delivery. So yeah, during the third stage of labor, the placenta will be delivered. Typically it lasts, can last to 30 minutes to an hour. Sometimes the placenta doesn't even need to take that long. But during this time, all you need to do is relax, because your body will do this automatically. And you can, the doctors are doing the tests and the things that they need to do in order to make sure that your baby is okay. And so a lot of that attention that was on you is now on the baby, right? So you'll feel like oh, okay. But yeah, you have the support of your family there. And I say that just because like it's hard for I feel it's hard for a woman to have had just birthed the baby, and now the baby is, you have a little bit of skin to skin time, but at the same time, there's tests that need to be done and ran. And so yeah. So you'll be asked to push gently one more time to deliver the placenta, and the uterus will continue to contract to help it return to its normal size. The doctor will also determine whether you need any repairs due to tears of the vagina or vaginal region. And so that's called a epistia. I don't know how to say that word there, but yeah, this is the perineum. If that was cut, the doctor may sew up that space so that can heal again. And this can be pretty painful because like when you sit, you're risking that they may break open, the stitches may break open. And so, just something to keep in mind while you are healing. So the post-birth period is a really important time, again, for bonding with your baby. There may be a nursing team that is monitoring your baby closely, making sure that they are adjusting as expected outside of the womb. The baby will take that first breath, and so what's happening is the baby's lungs is filling with air a few moments right after delivery, and this is that first important breath. And they say not to freak out if you don't hear a cry right away. Some babies may cry and some babies might not. It's kind of a response to the stimuli of the environment. So the doctors they like the fact that the babies cry, because you can hear the fluid clear from the respiratory tract, right? So there's like the tears are coming down, and that's kind of get clearing away. So the nurses will encourage the baby to cry or breathe by like rubbing or drying the baby's body. You'll notice that if you see in videos, we'll post one too, so you can see. And so that's what's happening at that time. After birth, the umbilical cord will be clamped um, and then and kept, you know, together for the baby for about 30 minutes. No, I'm sorry, not 30 minutes, a couple seconds, couple minutes after birth. And again, there is a recommendation from the American Academy of Pediatrics saying that delaying the cord clamping from 30 to 60 seconds is important because it boosts hemoglobin levels and iron stores and increases circulation, red blood cells, and it increases red blood cells in preterm infants. So, um, yeah, if you deliver the baby vaginally and the baby is healthy, you want to have immediate skin to skin contact. This is sometimes known as kangaroo care. The OBGYN will lay the baby on your bare chest or your tummy right after delivery and drape a blanket over the two of you to keep baby warm. So this is called skin to skin contact, and this has been shown to help regulate the baby's heartbeat, breathing, and body temperature. It also helps stimulate the baby's interest in feeding, and it helps to calm both you and the baby. And you're kind of like co-regulating with each other and increasing a mother-child bond. After birth, the baby will get their first nursing session. Bringing your baby to the breast as soon as you can will start sending messages to your brain to begin milk production. The baby will initially receive colostrum, which is a thick fluid that is rich in amino acids and lots of other healthy stuff. And that comes, that's like what's coming out of the mother's breast, the colostrum. And this is what is helping that baby build their immune system. It is the only food that your newborn will need for the next few days until the milk fully comes in. And that usually takes from 2 to 5 days after birth. But again, every female is different. Doctors are going to conduct APGAR tests, and this happens 1 to 5 minutes after the child is born. The doctor is assessing the baby's post-delivery condition. So the doctor will look at the baby's heart rate, breathing, any muscle tone, reflexes, skin color, and each of those categories will have a value of 0, 1, or 2, and then all of those scores are totaled. So this is happening within the first 1 minute and then 5 minutes. So the 5 minute score is the most important because it will take a couple of minutes for the baby to get acclimated within the environment and start breathing. But this is the APGAR test and a way that the doctor can quickly determine the health of the baby. So the highest total score possible is a 10, although babies rarely score 10. Typically, it's 7 to 9, and that is considered a high score. And this is given to newborns who appear healthy and don't require additional assistance. While a score below 7 may indicate that the baby needs pediatric or NICU attention, or like pre-care attention, that the baby was delivered a little bit sooner than they just came out a little bit earlier. The APGAR test is a simple assessment of the baby's well-being in the moment, and it doesn't predict a baby's health future. So just because, the grimace of the child looks a certain way, it does not mean that that is going to stay that way. It's just like a quick checkup. At this time, the baby's vitals will also be checked. So again, with the APGAR test, you're taking the temperature, heart rate, Um, there's also the weight and length, as well as head circumference, that is being taken or written down, accounted for. And then they're going to double check that there aren't any injuries or any obvious issues at that time. The baby will receive a preventative medicine, which is called a K shot, and this is given within an hour of the arrival. And this is going to help with blood coagulation. Um, so basically, like if the baby gets cut, that the blood is able to kind of harden and come together in order to heal, and create like a kind of barrier. So the nurse is also going to put antibiotic drops into the baby's eyes, which will help prevent infections. And again, not again, but vitamin K shots and eye drops are required in most states. So just be aware of that. And this medicine, this is important to do for your baby, so that they can be healthy. There's reasons why there are like state regulations. So, I'm not sure if that's like a thing that you want or may not want for yourself and for your child. But the reason why we have these things in place is to make sure that we can have that child thrive within the environment that they're in. And so things like eye drops, vitamin K shots, Hep B vaccines, these are all very, very important, for the health of your baby, but also for the health of other people too. So the Hep B vaccine usually comes a little bit later, and this happens within 12 hours of delivery, and sometimes even at an in-office appointment with the child's pediatrician. So in future videos, I am going to go over what happens like within the doctor's visits, for that first year of the baby. But yeah, get those vaccines. So after birth, the woman may feel sore breast, constipation. If the perineum, the area between the vagina and the anus, if that was cut during birth, either if it was torn or if the doctor cut it, the stitches may be painful. And so you may not want to sit or walk for a little while that's healing. And again, it may be painful if you cough or sneeze because of that pressure within that area. You may experience hemorrhoids, hot and cold flashes, and incontinence. So after birth, there are these things called after pains. And this is when your uterus is continuing to have contractions for a few days. There's also vaginal discharge that happens, and this is initially heavier than your period, and it often contains blood clots. And the vaginal discharge will gradually fade from white or yellow, and then it stops after several weeks. So your body is healing during that process. The weight of your belly will probably be about 12 or 13 pounds. So that would be the weight of the baby, the placenta, as well as like the amniotic fluid inside. So you will be, roughly 12, 13 pounds. Everyone is different, below your full term weight. And so your body is adjusting and regaining its balance within that time. So after birth, emotionally, you may be feeling a lot of different feelings. There is something called baby blues. And it is typical for many new moms to feel irritable, be sad, cry, experience anxiety within the first several days after delivery. These are called baby blues and are very common and are related to physical changes like hormonal changes, even the physical exhaustion, and just the kind of experience of birth within itself. Um, and this is an emotional transition because you're adjusting to your new role. And at the same time, your body has gone through this huge process. And give yourself grace if you are feeling baby blues. But if you are feeling baby blues, you would already be in contact with your doctor at this time. And so they can determine if this is something that's more serious, like a postpartum depression, um, and they can provide you with the help and support that you need in order to get to a point of baseline so that you can help take care of your baby. So, postpartum depression is a more serious and a longer lasting than the typical baby blues, um, feeling lots of mood swings, deep anxiety, a persistent sadness. This is called PPD, and it can be diagnosed up to a year after giving birth. And so, keeping track of your emotional health is very important, and getting the support that you need and asking for help and advocating for yourself are all great things because you're not only helping yourself, but you're helping your baby and your family. If you have a history of a family history of depression, or if you do experience depression yourself, um, you can absolutely manage these things in order to have a healthy baby and to provide them with the environment that they need. You just need to make sure that you have support set up in place for you. And this is why it's so, so important that people understand the things that women go through when they are having children. It is not something that, you just decide one day to do. Maybe you do, but to think of another person having a life, you want to make sure that you're creating an environment in which they want to thrive in. So, thank you guys so much for tuning in for the stages of labor. In the next videos, we're going to talk about what happens, the growth of the baby, different like reflexes, birth defects, and we'll also talk about, the next kind of stages of the lifespan. Thanks.